Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today, Dr. Rohrich and his special guest, Dr. Erez Dayan, discuss fillers, botox, and other cosmetic procedures, all from the perspective of two of the nation's top plastic surgeons. And now, here's Dr. Rod Rohrich on MD Source.
Well, this is Dr. Rod Rohrich and Dr. Erez Dayan, and we are back at MD Source, and we're going to talk today about when are fillers okay, and when is Botox okay, and when do you need to stop using fillers and go to facelifting or something else, because people are just looking weird out there, don't you think, Erez?
Absolutely. I think, because fillers are so accessible, just people and relatively affordable, people are using them more and more. And as you mentioned, there's a use for them and an indication for them, and it's a different patient population than the surgical patient population.
Right. I mean, ever since the early 2000s, when the first filler came on board, it was Restylane. And then, of course, Botox was before that as a neuromodulator. Cosmetic medicine has exploded because most people don't want to have cosmetic surgery. They don't want to go under the knife, and that's why people want to have fillers. They want to be filled and, I guess, have their faces paralyzed. So tell us the difference between things like Botox and a filler, because people are confused, because sometimes people come in and they say, I want a filler to fix my crow's feet, and I'm going, maybe not.
Right. So Botox is an example of a neuromodulator, and basically what that means is it's a substance that blocks muscle activity, in short. If you have a hyperactive muscle, and it's been used actually in many medical cases first, for a variety of different reasons. If you have a super active muscle in your stomach or esophagus, it can weaken that muscle. But it can be used for aesthetic purposes too. For example, if the muscles of your forehead are overactive and causing the overlying skin to crease, and over time, cause creases and wrinkles, it'll weaken that muscle and lead to a more smooth appearance, and that's why it's become so popular.
Well, the amazing thing was, Dr. Scott in the 70s used it for a very abnormal problem with hyperkinesis of the ocularis muscle, which basically was almost debilitating. And that was the original neuromodulator, the Botox. And there are many different types of neuromodulators. There's 3 available in the United States. There's Botox, there's Xenamin, and Dysport. All are great, all are FDA approved. They have different duration, but more similar than different. And so they're safe. They're they can either partially paralyze or weaken the muscle. They last 3 to 4 months. Onset of action can be from days to up to 7 to 10 days. So they soften wrinkles, and you can use them also to actually, if you use it to weaken parts of the muscles around the eyes, you can actually get an elevation of the eyebrows. So there's a lot of uses. I use it to elevate eyebrows, soften the 11s, the crow's feet, soften the dimple in your chin, have your smile turn up, and even what's called a Nefertiti lift, where you actually can soften some of the neck muscles so that your jawline looks more powerful. So if you have the finesse to do that.
Right. I mean, I think, certainly watching Dr. Rohrich and other skilled plastic surgeons do Botox, people who are well-trained in the facial anatomy and muscles of the face can really achieve pretty impressive results, just analyzing the face, looking at the asymmetries, seeing, well, maybe this eye looks a little larger than that eye, or the smile can be upturned a little bit, and targeting those muscles in a very precise way can really achieve impressive results.
Right, and the good thing is, the good and bad thing is that they're temporary, and the bad thing is that they're temporary. But I think, as you mentioned, Erez, if you understand how to use it, where to use it, so it's all in the needle, proximal to the needle. The medication, the Botox, which is a generic term, works great, but know before you go. Have a board-certified cosmetic medicine person, which is either a board-certified dermatologist, plastic surgeon, facial plastic surgeon, or an oculoplastic surgeon do it. Those people understand it, and you have to be trained to do it. So neuromodulators are great for softening that look in the face, and also they actually long term can do things with improving skin texture. Mm-hmm. That's right. And what are some other uses of Botox and other neuromodulators that actually have been side effects of the use of Botox?
Well, Botox actually has had many different applications. One of them is for patients that have a lot of sweating, for example, in the armpit area or even the palms.
What's hyperhidrosis?
Hyperhidrosis, exactly. And actually, a number of years ago, hyperhidrosis used to be treated, in severe cases with surgery. There'd be sympathectomies, cutting nerves. And actually, Botox has really simplified that a lot. Another use is for migraines, as we were discussing earlier. It's a very useful in refractory cases of migraines where patients may be considered for surgery, where the sensory nerves of the face and neck may be compressed by different muscles. Botox can target those muscles and weaken them and give the physician and patient a sense of what migraine surgery may be able to accomplish.
Right. And I use it a lot in the management of bruxism and hypertrophy of the masseter, which is the muscle in the jaw that actually causes you to have a broad cheek. And I use that in certain groups of patients, and especially in Asians. In the past, they would actually be using surgery to cut off the angle of the mandible. Now you can use Botox to soften that muscle. And it's a treatment for bruxism. When you're grinding your teeth, it's an excellent treatment, doing it twice a year. But again, seeing a board-certified plastic surgeon or one of the cosmetic physicians I mentioned that's board-certified in these areas, these 4 areas, is key. So where else do you think neuromodulators have a use or will have a use in the future?
Well, it's a useful tool for a number of different applications in medicine, in different neurologic conditions, as you were mentioning with different muscle spasms, particular of the eye region where you have uncontrolled blinking, and if you need to weaken the ocular muscle. It's a tool that can really be applied from head to toe. As you know, people are applying it in addition to different things such as chemical peels and different kind of aesthetic treatments. Right. To augment and improve the results.
Right. And one of the other incredible uses is that it complements fillers. See, and so many times people confuse the neuromodulators, which are weakening the muscles, to the fillers, which are filling the area. And so many times if you use these two together, and I do that very frequently, one augments the other. In other words, the longevity of a filler will last longer. If you have weakened the area, especially around the perioral area, in the lips and the commissure. So Erez, tell us about some of the approved fillers, the different general types of fillers that are available in the United States.
Sure. So there are a number of different types of fillers. The most common filler are actually a natural substance called hyaluronic acid. And the benefit of that substance is that it's temporary. Some cases may last as long as a year to 2 years. Some people have noticed that these fillers may stay around longer in certain areas of the face. And then there are other types of fillers that are semi-permanent or permanent, different substances such as calcium hydroxyapatite or other materials that in certain cases are indicated to augment a particular area in a more permanent fashion that we use on occasion as well in the right cases.
Right. So let's talk about some of the fillers, the hyaluronic acid fillers, which I think all these are FDA approved. They're reversible fillers. They're softer, and I think that they're more patient friendly in most cases. And I like to use fillers that actually are reversible. And I don't think that we should be injecting permanent fillers in patients because they don't age well. And I think that's been shown in other countries and certainly in patients that all of us have seen. So the hyaluronic acid fillers. So Erez, what do you think about the use of hyaluronic acid fillers like in the temples and in the cheeks?
Yeah, so I think, as we've seen in the properly selected patient, it can really make a very nice improvement. The plus side is that it's temporary. So if the patient doesn't like the results for some reason, or decides to undergo something more permanent surgically, that result will melt away over time. And in cases where patients really do like the result, it's also negative because they have to, come back every so often to touch it up and to refill an area. But similarly, to find a surgeon that's has a very busy practice with fillers and is really skilled at where to put the filler and how much to put in and what type of filler to use. Different areas of the face benefit from different characteristics of fillers. Certain times you want a thicker filler that doesn't move as much. Certain times you want a thinner filler that's just more liquid and a little more mobile. So it really depends on the area of the body too.
Right, and I think that all exemplifies the need to have someone that really understands the physiology, the science, and can do it. So I think that that's the big thing that I see. We all see patients that have had spas, and by non-trained personnel, I see them all the time. I see the dropped eyelids and brows, and they've had it done in spas by I don't know what kind of non-trained folks that did it. And luckily, Botox, after a while, it actually does go away, so the brow does come up, but it can be debilitating for 3 to 4 months. And the same with fillers. Fillers are sometimes over-injected, sometimes they're injected in wrong places, so people can lose part of their ear or part of their nose or part of their lip and even blindness. So the key is, just because you can get a filler does not mean you should. You need to get it in the right place, but also by the right physician. So we can talk about that in the temple area. I think temple hollowing is a very early sign of aging, and we use some hyaluronic acid fillers there, Restylane or Juvederm family. Even on the top of the nose, you can use a filler to augment the nose temporarily up to a year. The tear troughs as well, and the cheeks. Tell me about the lips. Where do you think it works the best that actually, obviously in conjunction with a Botox type?
So, the lips are a very popular area for augmentation,
right.
And that's probably, like we were mentioning earlier, a reflection of social media and watching a number of celebrities who have augmented lips. I think, as Dr. Rohrich has mentioned, going to a surgeon that really knows what the normal anatomy should be like. The lower lip should be larger than the upper lip, not the other way around. There are intricacies in terms of what areas of each part of the lip should be augmented. The anatomy there is very important to maintain, and the surrounding anatomy is important too. There's the Cupid's bow and where the angles of the lips on either side are pointing, that all these intricacies the patient may not be aware of, but the plastic surgeon should be very, very comfortable with.
Right, and also everybody needs to look at the mirror. Look in the mirror right now and see your big eye and small eye. Everybody's asymmetric. That's why the Mona Lisa took so long for Da Vinci to paint, because it is an incredible testament to the asymmetry of the human being. And so everybody's asymmetric, and that's the beauty of all of our individuality. So the expert injector knows that you can improve on that asymmetry, but you can never totally correct it. And fillers fill, they do not lift. I hear that on Instagram and even in presentations all the time. A filler brings out the cheek, and it doesn't lift it. Surgery lifts it. Fillers fill, and they don't lift. Fat fills, but it doesn't lift. And that's why it's so important for us to understand the science of aging, how the humans age. We age in the central part of our face. Our eyes lose fat. Our cheeks sag. And once cheeks begin sagging and you have a jowl, that's the cardinal time to stop filling. Because I see patients all the time that have had fillers and they have jowls, and then they look like a chipmunk. And we all like chipmunks, but chipmunks don't look good when they're in humans because they have just had too much fillers. You need to know when to stop. And the cardinal time to stop is when you have jowls and you're having fillers on top of the jowls. It makes your central face look very full and puffy.
Absolutely. And, if you look online, there are many examples of patients that are just overfilled to the point of disfigurement. And,
it's sad.
It's unfortunate because it sometimes could be an unfixable problem over time. When you continue to fill and fill and fill with either permanent fillers or other materials, it can just, and as a matter of fact, it can even impede the potential result of a surgical rejuvenation procedure.
Right, and I see that all the time, especially in women that have had too much fillers to their lips, their upper lips. Even melting it, when they've had it so long, they end up with this long lip because it's from the filler. So there is some permanent effects to fillers and recurrent fillers when they really don't need it anymore. Because as we age, in understanding the science of aging, we lose fat on our central face, so it's okay to fill it up to a certain degree, 40s, 50s, but at a point in time when you're distorting the face because you're actually trying to fill or try to lift by a jowl, you can't lift with a filler. You can fill it. And that gives you a very distorted, unnatural look that even on Instagram does not look good.
Absolutely. There's as Dr. Rohrich is mentioning, there's a time and place for it, and in the right patient, it could be great, but more is not always more, and more is not always better. Yeah. So really having the right facial analysis, right plan, can actually be much more effective. Many of these minimally invasive treatments are very attractive because they're inexpensive and readily available, but in the wrong patient, they can actually end up becoming much more costly and much more problematic.
Right, and some of them may be reversible. So again, that adage, just because you can does not mean you should. Mm-hmm. So all these things, we've talked about the great positives of fillers and of course how they differ from neuromodulators like botox. So what are some of the risks that people need to know about, the consumer needs to know about these things? So they're all, if done properly by properly trained plastic surgeons, dermatologists, and oculoplastic surgeons and facial plastic surgeons, a high majority of the time they do well. So, but tell us about the risks and how do you prevent them?
Well, fillers can be very powerful, and powerful can be very good and can be very bad. So they can lead to a very nice aesthetic result, and they usually do in the right hands. But in a certain percentage of patients, there can really be some disastrous effects, as Dr. Rohrich has mentioned. Throughout our face, we have blood vessels that are supplying our nose, our ears, our eyes, and many times these blood vessels are interconnected, and if you inject improperly in an improper plane, meaning depth, improper location, you can, there have been disastrous cases of patients losing blood flow to part of their nose, requiring nasal reconstruction. If you're injecting around the eye area and the tear trough area, there is potential for blindness. So really having a skillful injector is critical. And technique is everything, and knowledge of the anatomy is everything.
Absolutely. So here are the questions you need to ask when you're going to get your filler, and hopefully you're not going to a spa or a mall, but you need to ask, okay, how well trained are you? Do you do this often? If you're injecting it on the top of my nose, I want to make sure you've done it hundreds of times. And what kind of filler are you using? Are you using an absorbable or a resorbable non-permanent filler? And also, what happens if you have a problem? Do you have hyaluronidase, which is the reversal drug for this? If you have a filler and you're using fillers and you don't have the reversal drug, which is called hyaluronidase, you shouldn't be doing fillers because that is a surgical emergency. So if you have an injection, this can happen to anybody that's doing it, and all of a sudden your lip or nose turns pale or white, you need to reverse it with hyaluronidase, which basically melts the hyaluronic acid, and you need to inject it till it clears, and that is something that's part of your armamentarium. And of course, obviously, knowing the anatomy so you don't enter any of those 6 danger zones that can cause you to have permanent blindness is a disaster. So I think know before you go, find somebody who's board certified, find somebody that's got expertise and experience to do it, uses non-permanent fillers and has hyaluronidase on in-house right there is very important.
I couldn't agree more. And the other thing is, tourism, plastic surgery has become more popular, if you're traveling to Asia or South America, and many times it seems attractive. Maybe I'll get some filler or some Botox in those areas. Just maintain the same principles, because we've all seen unsterile materials that ultimately become infected and can really lead to big problems later on. So.
That's right. And actually I saw a patient last week that had a permanent filler injected in Europe and in her lips, and she's a beautiful woman, and there's nothing I can do. I don't even know it was silicone. I have no idea, but there's nothing I can do because it's inflamed, and all I could tell her was that, we'll see, time will tell, because there's nothing you can do to remove that after it's injected is really more deforming. So know before you go, know what's being injected in your body. You wouldn't be eating anything you didn't know. Certainly you don't want anything injected in your body that's going to be harmful to you in any way. So again, from MD Source, being safe is always important, but the best safety valve is knowledge. Knowledge is power, okay? And that's what MD Source is all about. Thank you again, Erez, and
Thank you.
We'll look forward to the next MD Source.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.